Today, we're diving into the story of a fascinating molecule. It's a true unsung hero in the world of medicine, one that protects one of our most vital organs, the liver.
So, I've got a question for you. What do bears and your liver have in common? I know, it sounds like the start of a really strange joke, right? But the answer is actually this remarkable drug that has totally changed the lives of thousands of people. And believe me, the connection is way more direct than you think.
And there it is. The answer is Ursodiol. The name literally comes from urso, the Latin for bear, because, get this protective bile acid was historically sourced from bear bile. Now, thankfully, it's all synthesized in a lab today, but its wild origins are right there in its name.
So, like any good hero, Ursodiol has an origin story, and it's a really interesting one. Let's take a look at where this stuff actually comes from and what makes it so special.
What's pretty wild is that our own bodies make ursodiol, but only a tiny amount. We're talking just 1 to 3% of all our bile acids. So in the tough chemical neighborhood of our liver, it's this rare but absolutely crucial good guy.
And that tough neighborhood is where the plot thickens. To really understand why Ursodiol is the hero of our story, we first have to meet the villains, the toxic bile acids it's up against.
Okay, this slide breaks it down perfectly. It's really a tale of two different chemicals. On one side, you've got these harsh, toxic bile acids. They're hydrophobic, they hate water, and they act like a harsh detergent, literally dissolving the protective membranes of our liver cells. Not good. But then, on the other side, you have our hero, Ursodiol. It's the complete opposite. It's hydrophilic, it loves water, and it's completely non-toxic to our cells. It's designed to be a protector.
So how exactly does our hero fight back? Well, it doesn't just have one move. It has this incredibly effective, three-pronged defense strategy. It's pretty brilliant, actually.
All right, here are its 3 superpowers. First, it displaces the enemy. When you take Ursodiol, you're basically flooding the system with the good guy, which dilutes and shoves out all those toxic, damaging bile acids. Second, it flushes the whole system out. It kicks up the flow of a healthier, gentler kind of bile that acts like a power washer for the delicate bile ducts. And third, it protects the cells directly. It literally steps in and blocks the self-destruct signals that those toxic acids try to send to your liver cells. So it's not just one thing, it's a defender on multiple fronts.
A great defense strategy is one thing, but where does it actually make a difference? Let's look at the real-world missions where this hero truly gets to shine.
Its biggest and most important mission is fighting a condition called primary biliary cholangitis, or PBC. In this case, it's not just an option, it's the absolute first-line therapy. It's been proven to slow the disease way down and help people live longer without needing a liver transplant. It's also used to dissolve certain kinds of gallstones, a great non-surgical option. And it provides huge relief for a really tough condition in pregnancy that causes severe itching.
Okay, so we've got the origin story, we know its superpowers, and we've seen its key missions. But what's the final verdict? How is this protector actually used out there in the real world?
For its main job, treating PBC, the dose is really specific. It's all based on your body weight, usually between 13 and 15 milligrams for every kilogram you weigh per day. And here's a key detail. You've got to take it with food. That helps make sure it gets absorbed properly so it can get into your system and get right to work.
Now, maybe the most amazing part of this hero story is how safe it is. I mean, for a drug that is this effective, it's incredibly well tolerated. Look at that. The huge majority of people, 90%, have no issues at all. The most common side effect is maybe some mild diarrhea, but serious problems, extremely rare.
So, let's wrap this all up. What do you need to remember? Ursodiol is a protective bile acid with a totally surprising origin story linked to bears. It fights liver damage with that 3-part strategy: displace, flush, and protect. It is the absolute cornerstone treatment for PBC, and it does all this while being incredibly safe. It's a true workhorse in liver medicine.
I want to leave you with this quote because I think it just captures the importance of this molecule perfectly. It's called a cornerstone of therapy that fundamentally alters the natural history of a chronic disease. Think about that. It doesn't just treat symptoms, it changes the entire course of a disease. It's not just another pill. It's an unlikely hero that has become an indispensable protector for the liver.